Thank you for joining us today. My name is Mike Walker. I am the president of the Voluntary Benefits Shop. Thank you for joining us today for our bi-weekly webinar series. I'm really excited about today's program. Today, we will have the team from Truusight on today to talk about their services and their hospital indemnity program. We have Alan Bergman, Lorenzo Cateo, and Jeff Sepisi from the team. Many of them old friends, so I'm excited to have them on today to help educate us on this program. Great, innovative program that we're really excited to be part of the rollout for. With that said, Chelsea, can you go to the next screen? Okay. Most of you are familiar with the Voluntary Benefits Shop. But if you're not, what the Voluntary Benefits Shop does is we provide expertise, products, and enrollment solutions to help support you, the broker community, and your employer clients with their voluntary benefit needs. So if you have other clients that you'd like to talk about voluntary benefits for, please feel free to reach out to us. My email and contact information is on here. The website link is also on the screen that you see here. We'd love to hear from you and help you with any of your voluntary benefits needs. With that said, I'm going to turn it over to Jeff Sepisi from Truusight Health to share with us this great product. So Jeff, you and your team, take it away.
Terrific. Thank you, Mike. Appreciate the introduction. What I want to start with is thank everyone for their time, as I realize from being in this industry for 35 years that it's awfully hard to put aside time like this, but it's also very important. So we're very thankful and blessed that you've all joined us today. And today's subject, it may be one that you're hearing a lot about every day, but we're going to take it to a different approach level because we're the only company of our type that's focused in this at a payer employer level. So I am the CSO with Truusight, Chief Sales and Strategy Officer for the company, also one of the founders and owners. I have 36 years in voluntary benefits, so I have a lengthy time in integrating plans effectively with employer groups, over 5,000 groups in my career. But more importantly, in the last 20 years, was very fortunate to get in some larger companies that grew, became mega accounts. And as I did so, I started partnering with a lot of the larger firms like Aon and Gallagher and NFP, which helped me develop not only a keen sense of truly integrated approach to healthcare, but also understanding population health management and other things that have kind of grown my consulting firm that I started in 2010 that has taken us to where we are today. So I'm going to introduce Lorenzo Cataya, so he can take a minute, tell you a little bit of his background. He is our regional sales director for the Northeast and will run point for a lot of you on the actual Truusight disease management services should you have clients that have a need for it. So Lorenzo.
Well, good morning, everybody, and thank you again for having us. I also want to thank Michael and your team at the VB Shop. Again, my name is Lorenzo Cataya, Regional Sales Director at Truusight Health. We are the full continuum of care, and at that, I'll also say that I've also been in the VB space for over 25 years. I will now pass it to Alan Bergman. Alan is Director of our TruAssist, which is the HI product that we discussed today. So with that, Alan, take it away.
Good morning, everyone. Kind of sounds like a little bit of a broken record here, but also with about 35 years of experience in the voluntary benefit platform and broker market. And looking forward to sharing some information with you today, kind of what's out there and a very popular subject that everybody's talking about. And Jeff will take you through and show you a solution that is unique to Truusight Health. So have a great day. Looking forward to talking with you all.
Thank you, guys. And I will go at a pretty brisk pace just to respect everybody's time, leave some time for Q&A at the end. However, the PowerPoint will be available, and we're here to be able to have one-off conversations as this is stripped down to give you a sense of what we're doing. So brain health matters. I think today it's something that people are keenly aware of for the most part that people never wanted to talk about. Nobody wants to admit they're dealing with a substance or addictive disorder issues and the co-occurring mental health problems. But with COVID, it just threw an accelerant on it. And one of the two great things that came out of COVID was employers are finally addressing and talking and realizing it's a real problem. You can't just spend the billions of dollars on healthcare for the physical health issues and ignore brain health anymore. So we're very excited to share with you about who we are. Truusight Health is a workplace solution for substance use and co-occurring mental health disorders. To clarify, unlike Spring Health and Ginger and Lyra, who provide different programs that can use to help deal with the problem, they're on the provider side or the patient side. We are not an insurance provider. We are not a medical doctor. We are not even in an EAP. We don't replace or change in those places, those services and resources, but work to actually make them work and have them come together in a much more effective way to lower costs and improve outcomes. I think all of you are aware today it's a huge widespread epidemic. Even before COVID, opioids were a massive problem. It was the nation and is the nation's biggest pandemic that we have. It's now escalated with alcohol catching up right to it, everyone going home, working from home, and those issues, not to mention the related stress to what we've all been through for a couple of years. So when I share this subject, for many, it's one of those that nobody really was talking about, but now there's a lot of talk, but there's very difficult process in finding a solution. 75% of Americans with untreated substance use are in the workplace. So think about this across all your different client opportunities and new opportunities that are out there. No workplace is unaffected, but there are sectors that have higher industry relative utilization. I'll name them very quick, but you'll see them later as we follow up with you. But construction, trucking, manufacturing, healthcare, public sector, schools, and then unions. This was actually birthed out of a major union 3.5, 4 years ago, who was a client of ours who turned around up from the voluntary side and said, we're having a significant problem. Do you know anybody that's managing this? So we looked into it. And of course, we learned, like everyone else learned, that this is something that's been so ignored, but look at the impact it has to the total cost, $740 billion and growing, and that was from 2020. On average, any employee or dependent who has undiagnosed substance use disorder adds an extra $1,267 per person, just the cost of a health plan. That's across the board. When you see the numbers for people actually who get identified, it's much greater. So why do we start off telling you about brain health and this important impact financially in our ecosystem of healthcare? Is because it's a great entry into large accounts. And this is what has me very excited after 37 years of working with voluntary benefits. We all know how often you try to talk to the CEO or the president or the COO of the company, but you get immediately handed down to HR and many oftentimes a broker. What's very unique about what we're doing is we don't get that hand down. They're actually called in to listen to us, which is really unique. So we are able to and help you guys approach those larger companies, especially if they're self-funded. That's our sweet spot, is to be able to talk to them at a C-level, whether you currently have them as a client or not. So keep in mind, this is a great way to walk in and talk to companies that normally you don't even get to that level. So on the screen, you see a very important statement. It is not what you see. It's what you don't see that's causing the major havoc and the major costs and the major problems in our country with this issue. Only 1 in 10 people who have a substance or alcohol addictive issue receive care. Now, make a note of that. When I talked about those 8 leading industries, the construction, trucking, healthcare, they somewhere see between 22 and maybe up to 40%. Nobody really knows because COVID numbers haven't even been, factored in. But let's just say comfortably 25% of the workforce in the most significant industries, they're facing problems with substance, alcohol, or mental health. But out of that 25%, so if you've got a 2,000-man group, that means 500 are somewhere out struggling with us. But out of that 500, only 50 are getting treatment. That leaves the rest figuring this out on their own. And one of the major problems that you have, and you ask why, is because there are 4 significant barriers that help employees from reaching out sooner. The first, and the one that is still there and it's massive, is stigma. And again, this is a brain illness. It's not a physical health problem. Yes, people are aware of when you go through issues of substance or alcohol, you go to a detox or rehab. Well, that's the old way of thinking. But all that did was treat the physical body, which can be cleansed in a 30-day period. But opiates rewire brains. Alcohol rewires brains, and it's proven, and the evidence now is so advanced in that there is a much better care path, but it has to involve treating the brain receptors and other components of it. So how do you go about doing that? if the first barrier is the fact that I don't want to tell anybody I'm battling substance or alcohol or anxiety or PTSD because I fear what? I fear being outcast. I don't want even my social circle to know. But think about it from an employer standpoint. Employees get fired for far less. So unless an employer, and there's very few that we've run into, have built a culture where it's safe to come forward and talk about the problem with substance or mental health, people aren't, and they aren't willing to because they're worried about losing their position or losing their job. So privacy is that second barrier that's critically important that we have to address, and we've done so with the tools and technology that we use, and helps us to be able to break down those issues. The third barrier is just navigating the networks. Understand what I said up front. We don't replace anything the employer has in place. They already have a quality health plan, especially again, we're working large companies, 500 to 1,000 and up, self-funded. So they have very strong health plans in place. They typically all have an EAP, regardless of what we all know they limited to do. They do have an EAP. They have telehealth and many times some other resources they've worked with. Maybe they signed on with Ginger to help with their campaign or a wellness and screening that's done some part of this. But these resources are all disconnected. Think of them as a pile of bricks laying on the ground scattered. Those bricks do nothing other than identify different components of a foundation. But if you had mortar and you could put those bricks together into a pathway that was secure, you can get to a desired destination. That's what we are. We are that pathway. We are the ability to connect those resources and help people navigate through all the different provider networks and challenges that people face. But the other big problem, and this gets to the insurance part of today's discussion, is financial implications. If someone's okay and gets past the stigma and the privacy and then can figure out how to navigate what is a very, very complex world with substance mental health treatment, the next question is, how do I pay for it? So much, again, is being done privately because, again, they don't want the employer to know, so they don't use employer sources that are there. Or more importantly, they've got high deductibles, high out-of-pocket costs, can't afford to be out of work. They've known somebody that went through rehab, has gone 3 or 4 times, 28-day stay or 14. So they see it didn't work. So you have all these things that people battle, and yet they're not going to be solved unless someone can proactively go in and do it differently at the workforce. So that's where we become the solution. Truusight Health created a chronic disease management program that is very proactive, not reactive. Remember, the only time Blue Cross or Aetna or Cigna or EAP or telehealth hears from an employee is when they actually make the call. So they have to be reactive to someone reaching out to them. We're the flip side of that. We're proactive. We are able to provide a solution that not only manages the disease as someone does come forward for these specific areas, but more importantly, we integrate seamlessly with what they already have in place, including their benefit communication, their HR, admin, HCM system that's in place. We don't change anything. We're just the mortar. We're the glue that's going to finally come in and put all this together to help identify where these employees are that are undetected, undiagnosed, and untreated. Remember, that's 90% of them who are having a problem are not diagnosed yet. They're not detected. We know who they are. We can find who they are through data, through evidence-based, comes from pharmacy claims and medical claims and work loss claims. So what do? We will first assess risk for one of your clients. And when we assess risk, we do a risk stratification using a data algorithm. Our data looks at pharmacy claims up to 2 years, medical claims, and we're working to include looking at workers' comp claims because this is a significant impact on that side of the equation. We built a data algorithm called True Data that is patent pending that goes well beyond what you would see a PBM can do. Again, PBMs have real value. We actually modeled some of the things off of that, but they stop short of addressing the actual problem when it comes to substance and mental health. Everyone does. And the third thing we do is we developed a population-wide screening. There wasn't one. We brought TruScreen out to the workforce because there's nothing that integrated the screening questions between mental health, meaning PTSD, depression, bipolar, anxiety, sleep deprivation, and substance, whether it's alcohol or opiates. We knew it was important that they were integrated because, get this fact, 60% of the people who have a substance issue have a co-occurring mental health problem. It's the chicken or the egg. So we assess all this risk with population tools we've developed that are proprietary to us. And then we start the next step, which is to work with the workforce. And that starts with an education process. You've got to break down those barriers we just talked about. And by doing so, we create curated custom workplace campaigns. And I'm going to show you the technology near the end of our presentation that's going to excite you, because this technology not only works for us to go out and bring Truusight benefits to the workforce effectively and start breaking down denial and dismissal of the issue that many people fear. I got it under control. It's not a real big issue, but we know they're going to slide down that slope toward a turning point. And what we want to do is build a trust. But the same platform we use can integrate the voluntary benefits and do it far more effectively than the types of programs that you see out there that or platforms that people use currently to address those problems. So we're really excited that they have been able to embrace being able to include the voluntary part of this. In addition, integrating an interactive mobile app is very important in what we do, because a lot of people, again, don't want to talk about these issues with HR. So having their own one-to-one connect with us right through it on their time, and make a note in the mobile app and interactive world, that's where telehealth is becoming more and more of a used function. Before COVID, couldn't get anybody to COVID health. You couldn't get anybody to do telehealth. But then we were forced to do it. And then so many people adopted it and actually liked it and saw, well, this does work for a lot of certain everyday things. Well, it's very critical because it can work in great ways for substance and mental health therapies and counseling, where people don't have to physically go to a doctor's office or miss work. And then this content becomes adaptive. In our platform, the technology not only learns the employees from a psychological segmentation, but it also then modifies their specific content in the way they need to hear it. So whether it's text or email or video or other media formats, every employee is not treated the same because they're not. And once we understand and learn that employee, we actually can change not only what type of wording goes into our content that we know has proven by science and psychological profiling that we know will help them to pay attention, but we can actually help them break down the barrier to behavior and take action by when they receive it, how often they receive it. So it's really cool technology, and we're very excited because as we shared it out with consultants and other people, they get pretty excited to say, man, where was this? If we had this for voluntary benefits over all of our years, we would have all written multiple times greater amount of premium than what we were able to do with the standard approach. And then once you obviously identify and measure and assess, then you educate and break down barriers. The next step is now employees or family members reach out. And as they come across and it's their time to address the problem, we will then provide the full care management. We oversee and manage all the resources. So one of the things we'll do with the employers, look at everything they have in place and then identify where we can go ahead and link those opportunities for sources. If there's gaps, or inefficiencies, we point those out, and we then will be able to provide, especially in the self-funded world, options for that employer to now make available that will help address the problem. We create a resource utilization program that allows us to identify how to utilize the resources. That means we're connecting and coordinating appointments, care paths, following up with the patient. And I want to make this statement. The end goal for cancer is not treatment. But you hear about that all the time. It's remission, right? You want to get somebody cured or to remission. Well, the end goal for substance and mental health is not treatment, it's recovery. And more importantly, it's sustainable recovery. So our care services go all the way through till not only recovery, but beyond, bringing peer support and recovery support to the equation. So those are the three pillars of what we do. I hope that gives you a nice overview of who Truusight is, what we are. Obviously, today we don't have time to talk how we do it, but in front of you is our continuum of services. True data, algorithm, patent pending allows us to measure through all the different claims we talked about. True screen helps us get at the workforce level, the current, the now, picks up alcohol and other issues. True Talk is our customized technology platform to be able to deliver and engage to break down the barriers. True Connect and True Support is the care management services that we kind of highlighted. Lots of detailed information on them we can share with you in one-offs and follow up with you. So please reach out as you see you'd like to learn more. But we are going to focus on True Assist to end the call, and that is the insurance product that was developed to go along with this. So we are currently working with about a half a dozen carriers to develop additional products to the current one out in place now. So keep in mind, our goal is to have a small suite of HI and CI products that are far more enhanced and robust than what's out there today. Majority of all companies over the last year to 2 years did relax or remove their mental health restrictions. So that's been a positive step in a direction, but most stop there. Most still are very concerned, very nervous, and very unaware of the risk, so they can't price it or deal with what kind of claims are going to be to now completely remove substance and alcohol. If there are plans out there covering it, they have a lot of restrictions to them. And so there's a need in the market to take standard HI, hospital indemnity, and standard CI, critical illness, and improve those plans, not change them in what they're covering, all the typical physical things they do. That needs to remain, or you get adverse selection. We're not selling a addiction recovery policy here. What we're doing is taking plans that people need, are willing, and paying for, but now stop blocking brain health services. So we're expanding those benefits and improving upon them. Again, our Truusight products are designed to make sure there's inpatient services, outpatient, telehealth and telemedicine, which I pointed out, emergency room, urgent care, and then some key factors we want to make sure they're guaranteed issue during the enrollment. So someone already has a problem with a mental health or substance or alcohol, they know they can come forward right now during initial enrollment, and coverage is going to be guaranteed. If they wait and don't do it till subsequent years, they'll have to go through underwriting. And then no pre-existing conditions or limitations, which is very important. They want to wait to be able to get coverage. You need to help people when they're ready to go, not on our terms. With our True Support Services, currently the Aflac product that came first to market for this more a year ago, they were able to take their Group HI product, work with us, utilizing our expertise and help to expand benefits that are not available when you file for a standard HI quote. The plan has completely removed all restrictions to substance, alcohol, and mental health for all covered areas. And I'll hit a few of the benefits in a moment. For sales support, you see, we'll provide scripts, as you see it on the screen, of how to talk to an existing Aflac client if you have them, or someone that's not Aflac. A flyer you can utilize that highlights the benefits, as you see to the right. We run the proposal quotes for you. You have to go through our quoting process to get the custom quote and those custom plans with the rates. But the cool thing is commissions. Truusight doesn't take any commissions from the broker or producer level, so the full commissions are there for you to arrange how you see fit. If you need a arrangement, we can do commissions anywhere on a 5 or 10% basis. We just need to have obviously about a 7 to 10 day period to set that up for you. So you'll tell us who should get paid and what breakdown, working with our team, and we'll create the appropriate commission statements for our commission arrangements. There is a heat and a level for this current HI plan, so whichever way you need to operate, we have the flexibility there. And then I think most of you are using VB Shop and others to do your enrollments, but when you run into certain groups where maybe you have an enrollment challenge with it or need help, we do want to make you aware we can provide enrollment support, either virtual or even with an in-person hybrid. There would have to be a share of commissions, obviously, to pay for our enrollment services like that. We're not in the enrollment business. We had to bring it there because groups like Marsh and Aon that are now looking and talking to us for their largest clients, they don't typically want to do or deal with the enrollment arena. So we've had to make sure that our platform could integrate and provide that. So we have that. So talk to us if you have or need for that solution. But in the end, I think most of you, because you're on the VB space, already have a preferred, trusted way that you handle and enroll your voluntary plans. The additional things that you need to be aware about this product is, one, it's available to any group over 100. 25 payer requirement to participate. I talked about guarantee issue and no pre-X, very important. We do have to have active enrollment. We won't allow this to be put up on a website, and if employees want to look at it, great. Because of adverse selection issues, there has to be a strong supporting engagement. That's again why, if you're working with the full Truusight program, you're going to have that kind of support, because the employer is now bringing our plan out, which is a PEPM. They're paying for it. The employer pays for the actual disease management services that we provide. So now it's just like offering them another benefit. So if you all of a sudden announce to employees, we have a new benefit that's your employer's paying for, most, if not all, are going to want to know about it. And that's what makes this great for all of you, is because if we get Truusight in, and that's the lead, then the insurance is just an automatic part of what we're providing. It's like, here's the screening, here's the True Talk, here's the True Assist for the financial barrier, and we talk to them about the plan, and then move from there to whoever's going to enroll it with you guys. You also see that if the case includes our care management services, we do have to have your enrollers or advisors, whoever you're using to talk to employees, will have to sign disclosure agreements with Truusight Health due to the content and proprietary information we provide. And if the account current has an Aflac Group HI in it, this would obviously replace it. You wouldn't have both running concurrently, but Aflac has agreed to have the employer keep their current plan if it's actively enrolled by grandfathering them, as long as the existing pay deductions stay active with the employer. However, when people find their plan doesn't cover these things and ours does, and it has more benefits for about the same price, they're likely going to switch and upgrade to our plan. If they have the traditional HI plan out there, not the group plan, then they could continue offering both concurrently. So that's the only different. So if it's group, Aflac currently, we can't run concurrent, we would replace, but they would freeze and grandfather. If it's an individual HI with the Aflac traditional side, then we would simply can be concurrent, but you decide on your own if it's necessary. And then to wrap up, the benefits are pre and post tax available. Any pre-tax plan with an existing HI, any carrier, guys, the great thing about this plan is it meets the one of the requirements to open up mid-year. So compliance has already approved that you can go in middle of the year if they already have an HI plan in place, and you can put in the new plan with us because it's a significant improvement in coverage. This would be required, the account would be required to sign a hold harmless agreement to do so, but they can come in mid-year, so you don't have to wait to open enrollment. However, we all know, being a VB all our lives, that more often than not, the larger the group, the more they want to do their benefit enrollments all together and integrated with the core benefits one time a year. So you might be stuck doing that anyways. Unions, very important, already approved, eligible for. You definitely want unions to be talking to if they're managing their own health and welfare plan. We have expertise in that arena, probably have over 25 major unions going now in the Northeast. So that's a very big hot spot, along with public sector. They've got a ton of funding through ARPA that came in, millions and millions of dollars flooding into states that are being appropriated to municipalities and schools. So if you have any specialty markets there, that's a great one to talk to our team about, because there's funding that can actually pay for Truusight. And if that takes place, you're going to get to sell the insurance and possibly other voluntary alongside it, just because we've positioned it as part of the solution. We also have an arrangement set up with PayLogic for the unions for their split direct deposit, but instead of you paying their fee, we've got it covered. So there's no cost to a union. If they put in the Truusight program for services, we'll cover and pick up the PayLogic's fees for providing that alternative funding to payroll deduction. The downside, I know you're in the Northeast, many of you, the Citus product is not available in New York and New Jersey. I think all of you know this. Their states are extremely restrictive. You can barely get benefits for HI. We are working with some carriers to be able to break that barrier in New York and New Jersey. It's going to take, longer than we think. We're hoping, fingers crossed, we get at least one quality product approved and ready to go by fourth quarter, so you can use it in the end of the year enrollments when a lot of the big accounts go. But plans can differ, and pricing can differ based on each Citus state. So depending where you're going to ask us for a quote, remember that. Don't say, hey, you guys gave us the plan, the sample plan design and rates, and this is different. It would be different. California is going to be different. Texas is going to be different. There's not, some cases it's minor. Sometimes it's just a definition tweak or something of that nature. But be aware that we do have to file a quote and present it to get your state's particular plan design and rates to come forth. And then if you take over any existing HI plan, for those people participating in HI who replace it with our new plan, you do get replacement commissions of a level 10%. You don't get the full commissions on it. Anybody that's a first-time enroller, you would be able to do so. So with that in mind, that's TrueAssist. It's 11:30. It talks about where we are with the process. I'm going to take it back to them for questions and go from there.
If anybody has any questions, feel free to go ahead and enter them in chat now. Jeff, I did have a question. I know that you said New York and New Jersey not available for cases Citus there, but I'm assuming then that means all other states it has already been approved.
Yes.
Okay, great. Guys, also I would encourage you. I know many of you have large groups, have self-insured groups. This hospital plan, as Jeff said, is just one aspect of what Truusight does to help with substance abuse disorder and mental health scenarios. I would encourage any of you who have those types of groups to go ahead and reach out to Jeff and team, or reach out to me and I can connect you to Jeff and team. to learn about Truusight Health services in general, beyond the hospital indemnity plan, because the other stuff that they do is even going to be more impactful from a cost containment perspective and from a benefit at the employee level perspective than even this plan is. So certainly we have a half hour here to share, and Jeff could talk for a few hours on what they do. So certainly reach out to me and I can connect you to Jeff, and he can give you the whole gamut of their services. I did.
Mike, can I interject on there? One of
Yeah,
the reasons
go ahead.
it's so important what Mike said, and I appreciate you bringing that up, is the type of savings a group for every 1,000 employees that we see in a workforce. Doesn't really matter the industry, some are higher. There's over $1 million that we find in spend right up front when we run the data. $1 million. So for every 1,000, $1 million is being spent that shouldn't be spent. And remember, that's just what's showing up. There's going to be even more cost savings because of alcohol and other things. So remember, when we talk about waiting to get hospital indemnity sold or critical illness, wouldn't it be great if Truusight services were put in place, and then after the first year we save that kind of money for them, and you go back in showing them the reports that we're going to provide you and say, now let's redirect a couple $100,000 of that funding that you now have back in your bottom line to paying for. There you go, right? To employer paying for CI and HI across the board, because now if everybody owns it, there's even more reason. Every employee is now confident they have dollars in cash to come forward and deal with the problem because they may not have enrolled the first time through. So just another little market opportunity. Where we think we'll go with this after year one and then year two is there's a lot of dollars that's going to be put back into that companies that they don't spend anymore the way they should in substance mental health that can be used to pay for benefits like VB.
Yeah, very true. Very true, Jeff. And I did see Natalie requested to have a follow-up call. So I'll make sure, Jeff, that you and team are connected with Natalie, who's on our call today. I saw that in the chat. Guys, I do want to make sure that you're aware of our upcoming webinars. April 28th, coming up in 2 weeks, we have the team from Allstate talking about how last year we used the Life with Long-Term Care Plan to help employers and employees prepare for the long-term care tax that was proposed in Washington State. As most of you probably know, there's about 15 other states that are considering implementation of the same type of long-term care tax. And so that'll result in a lot of opportunity, just like it did in Washington State last year. So don't miss that. That's going to be an important one. May 12th, we have the people from Triada talking about their GAP plan. They have a really innovative GAP plan that's actually available in all 50 states, which is important because, again, New York and New Jersey, tough to get a GAP plan, but they have one that is available in New York. We're actually using it on a case right now. And then on May 26th, we have the team from Jellyvision talking about their decision support tools, Alex. That can be used with really any platform, but can help work employees through their benefit elections. And if you're not familiar with the Jellyvision, that'll be a great one for you to look into and see how that can help your clients as they work through benefit decisions during this year's open enrollment. Okay. Hey guys, thanks again for your time today. Again, remember, we're here at the VB shop to help you with all your voluntary benefits needs. If you're interested in the services from Truusight, reach out to us. Or any other voluntary benefits needs that may be helpful to your clients, reach out to us. It's what we do every day, partner with brokers to help them, provide the best in voluntary benefit solutions. Again, thank you to Jeff, Lorenzo, and Alan for joining us today. We look forward to continue to work with the team from Truusight on and implementing these types of programs, and we do appreciate your subject matter expertise today as well. Thanks again, guys.